In America, where you live predicts how long and oftentimes how well you live. This isn't a distant problem about a neighborhood you've never visited. This reality actually impacts all of us. It impacts our workforce, all of our businesses, our national security, and even our economy.
Unfortunately, we're losing a lot of people every day, sooner than they should, because we haven't focused enough on this.
It's urgent now more than ever because people are dying. You know, when you see stats, you have to humanize what you're looking at, that those are real people.
Although a lot of the focus on business is the money motivation, the reality of it is we are serving the human population.
A healthier community is one that provides the environment in which the business can operate most effectively.
So investing in community health is the most bang for your buck. It is that old mantra of, an ounce of prevention is worth a pound of cure. It is the most efficient way to make sure that communities are full and whole and their neighbors are cared for.
Can you imagine having nonprofit and business and communities working together?
And I was always very proud to be in the nonprofit sector because we were always the most trusted sector.
Yes.
And a couple years ago, that changed. And the most trusted sector currently to solve the problems of the world are the CEOs of corporate America in particular.
And we have the power to create the change. It's not that we need to be on a mission for it. We have the solution and the ability to change the trajectory of future generations. And it has to be urgent for each of us because there's something for all of us to do.
We are senior leaders across the industry, nonprofit, government, and in communities coming together, believing that better health is possible, not just for an event, but a movement.
I think it's going to take a lot of different things. There isn't a singular solution. It's going to take a lot of different people with different perspectives coming together, building that trust, and sharing their expertise.
This is Leadership in Action, creating a new vision of community health that strengthens families, organizations, and economies. Join us on the Leadership Council for Healthier Communities. Together we can build a more resilient future for all.
Good morning, everyone. My name is Gene Axios. I have the great pleasure of serving as the President and CEO for LCHC, Creating Healthier Communities. We could not be more excited to see all of you this morning as we actually kick off the launch for the Leadership Council for Healthier Communities. I do want to start off as the leader of the organization to recognize all the individuals that actually make today possible. I want to first of all thank my amazing team, Andrea, Tyler, Morgan, as well as Leanne, who's in the back, and also our amazing partners, Liza and Kim. Had it not been for them, today would not have happened. So I just want to acknowledge and please give them another round of applause. And it's also critically important to acknowledge the partnership and the strong relationship that we have with our board of directors at CHC Creating Healthier Communities. I would like to acknowledge our board chair, Eric, who is joining us here. Eric, please raise your hand and just be acknowledged. I also want to acknowledge Howard Miller. Howard, please stand and be recognized. Howard is really the reason why we're in this beautiful space today, actually giving the launch. So I just want to acknowledge him, and of course all of our board members who are joining us via live stream. Just want to thank you for your ongoing partnership and support as we have gone over the last year to bring this actually to life. Let's begin with something that we all share, and that is time. Time is our most precious resource. It is finite, it is irreplaceable, yet in America, like we mentioned in the video, how long we live and how well we live is oftentimes determined not by our potential, not by our choices, but actually by our zip code. Think about this. In New York City, riding the subway from Midtown to the Bronx costs you nearly a decade of life, 6 months for every minute on the train. In Manhattan, neighbors who are just a few blocks apart on the Upper East Side and in East Harlem are separated by 20 years of life. This isn't just about numbers, it's about lost time. Birthdays never celebrated, graduations that are missed, relationships that are shortened, lives that are frankly interrupted. It's about lost opportunity, lost potential, and lost generations. And here's the actual truth. When community health declines, everything else declines as well. Families struggle, businesses weaken, economies falter, and trust erodes. And when communities actually thrive, everything thrives. Families flourish, businesses succeed, economies grow. The equation is very simple, and you'll hear from our first panel this morning. Healthy communities actually fuel healthy businesses. And we know this. Deloitte actually indicated that improving health across our country would actually add 2.4 trillion to GDP by 2040. And corporate profits would potentially increase by over $763 billion. So companies that prioritize community health attract better talent, earn more trust, and stay competitive. It is a business imperative no leader can actually ignore. For too long, corporate social responsibility was seen oftentimes as charity, that you just wrote a check, you sponsored an event, you did a fundraiser. However, the world has changed. Today, employees, customers, and investors expect so much more. Over 80% of Americans believe corporations have a responsibility to strengthen the communities where they operate. Over 70% say that corporations should help solve systemic issues. In a polarized, skeptical world, trust is extremely fragile, and once lost, it's hard to regain. That's why community health must no longer be seen as a charity, it is actually strategy. So welcome to the launch, hosted by Creating Healthier Communities. For more than 70 years, we have been proud to serve as an organization that unites nonprofits, businesses, foundations together, all around focused on addressing community health and well-being. We mobilize about 5,000 nonprofits on an annual basis, 1,300 of which are part of the CHC network, to actually improve community health and well-being through volunteerism, through community engagement. And our mission is more urgent now than ever, and that is to end preventable barriers to health, to close the gaps, to create resilient communities where everyone can actually thrive, because our greatest impact is always together. And today, we're taking our mission to the next level with the launch of the Leadership Council for Healthier Communities. This is a groundbreaking group of leaders from business, from health, from philanthropy, from nonprofits, all coming together to collaborate, to innovate, and scale solutions that strengthen community health. It is leaders like Rigo, who is the president and CEO of the Armstrong Foundation, who has actually committed through their foundation $300,000 in rapid response grants right now to meet the moment. It is leaders like Alan from Aradex, who has committed $100,000 as seed investment to actually start to address the mitigation of health loss coverage as relates to Medicaid. It is leaders like Arif in Ameriprise, who is focused on addressing mental wellness and well-being for their workforce. It is leaders like Jaquay Henderson, who's president and CEO of Square Pig Technologies, who is actually doing a lot of work with the Lymphoma Society, addressing the issues of cancer. This is what this is about. It is not about optics, it's about impact. It is not about discussion, it's about action. It is not about being on the sidelines, it's actually being in the mix, because collaboration is the new form of currency. So with that, I want to turn it around and hear from our first panel. I'm going to welcome all of you and thank you for being here today for what is going to be a very action-focused discussion, an opportunity for us to collaborate, to roll up our sleeves and really think about how we as a collective will actually address the moment in which we're in. So I have the great pleasure of actually introducing our first panel. And please join us as I call your name. This panel will be focused on healthy communities and healthy economies. We have the great Sabrina Spitaletta, who is the Senior Director of Public Health for the Employer Action Exchange over at Milken. We have Dr. Ashwin Basan, who is the Senior Fellow, Health Policy and Management at Yale School of Public Health. We have Arif, who is the President of Ameriprise Bank. We have Andre Bellalou, I'm sure I butchered that, Andre, please forgive me, who's the head of financial service industries at the World Economic Forum. And we have Courtney Gray Holt, who is the Global Health Co-Chair and U.S. Chair for Element. Ladies and gentlemen, please welcome our first panel.
Morning. Thank you, Jean, very much, and to your entire team creating healthier communities, and to all your invited guests. This morning, we're here to have start the conversation off in terms of the healthier communities. All of you are either in a local community with a global reach or national reach. You're an employer or a nonprofit. You're working together or will be working together. But the whole idea is that local really matters, right? That community, and that community is also employers. Employers have communities within themselves with the people that they employ and the communities that they serve in the surrounding area. So the way we're thinking about community is broadly, but also specifically, and then how to connect those communities for that larger impact. So with this, before we get started into our discussion versus just a moderated panel, there's three ways I want to frame our conversation. One is focused on this macro, this big picture, right? This reality, this grounding of what's happening in the world, where we are in 2025. Then move into people. People are at the center, this human-centered approach. And then the last part of our discussion focuses on that resiliency, or what is sustainable, what is that platform, what's last. So to start, Arif, I want to start with you in terms of you're a leader in Ameriprise, but also as a part of this leadership council. So I want to start with why. You've been in the financial industry for decades. You have this larger focus now on, well, over the years has grown, right? Of course, in terms of well-being. So from a macro level, I want from a one leader, you're at the intersection of business, community, and these health priorities. Why take a bigger stance, and what do you want to model?
Well, I think for me it's both personal and professional when I look at it. Personal because I'm not a healthcare professional. I'm a consumer of healthcare. Luckily, being on the privileged side of that, getting the best service, and most recently getting my knee surgery done. But I've also seen the other side of it, both in this country and also globally. And that drove a lot of personal desire to get involved, engaged in the discussion, engaged in what people do. On the professional side, I have to say, I was fortunate enough to start American Express, which is a great company. It takes a lot of good care of its employees, but the whole notion of corporation as an entity has fundamentally changed, where you take a macro view and you say, oh, there's this behemoth, JP Morgan, Bank of America, American Express, but ultimately they are community-based organizations, whoever that business may be. It could be a tech, AI-based business. Ultimately, there's an employee who lives in that community physically. And without the well-being of that employee, the well-being of the company will not happen. We all talk about it in discussions, and leadership discussions about, the single biggest asset of any company is the workforce. The question to me has always been, okay, what does that mean, and what are we doing about it? And that has changed. I have to say there's been a lot of positive change as well. Companies have stepped forward. You've seen some of it driven maybe by insurance changes, where insurance companies have said, let's get on the well-being so I don't have to pay out, right? But companies have also realized that productivity can only happen if you have an engaged workforce. And engagement does not happen just solely because of compensation or career. It is complex formula. But ultimately, the employee has to feel that they're a part of something that they can personally stand by, right? A different discussion, if I recall, in the 90s and maybe before, when I entered the workforce in the 80s, late 80s and early 90s, you brought a professional self to the work. You wore either a suit or you wore khakis and a blue blazer. I'm talking financial services. that was dressed down. But you left your personal self outside the door. You had to behave in a certain way, right? You had to operate in it was called professional. But that's going to change now, and whether it's the millennials or other generations that are forced it, they want to be true whether they're inside an office or they're outside an office, right? So you have to embrace that, and that involves all aspects of diversity, lifestyles, right? So I think companies are starting to get onto that now. So those are the two main reasons why I personally think this is a very important discussion for us to have. And it can't just solely be the responsibility of the public sector. The private sector is the largest employer when you think about it globally. The private sector has the largest amount of resources. And unless they step up, the public sector can't really do much.
So you want to lead by example, and you're in a position to be able to take that organization with you in that alignment. And the change of the multi-generational workforce is that this is not just any one generation, this whole person health and wanting to achieve your ultimate, perform well is at any age, right? And so that success and so that investment. And to be able to do that, I wanted to turn to Andre because you also have to be aware of the larger environment, right? And the risks. And you have incredible experience and research in terms of the work that you've done and 20 plus years in terms of the risk report at the World Economic Forum. And if there's some trends or some insight you could share from that for the leaders in the room and listening in, because that helps their scan of the environment, right? Figure out how they can act using this great research and insight. You could share some pieces of that. Thank you.
Thank you, Sabrina. Just for those who don't know, the World Economic Forum is a nonprofit that essentially our mission is to bring the public and private sectors together to solve the world's biggest problems. As we just heard, the public sector can't do it alone, and certainly the private sector can't do it alone. But we have seen shifts over the last couple of decades, not only on where a lot of the action is coming from, where the expectations of where action comes from. If you look at, and I think we're going to talk a lot about trust on this panel, when you look at what people trust in today's world, institutions that they trust, business has been going up, generally speaking, not all businesses, but business in general has been going up, whereas other institutions that we used to rely on, the trust factor has been going down. So people expect a lot more of their business leaders, and they expect a lot more of their business institutions, not only the ones that they may do business with directly, but ones that are pretty present in their community. And to go back to your question, Sabrina, around the Global Risk Report, it's one of the reports we do. We survey about 10,000 business leaders and public leaders from around the world every year. That's what's top of mind and essentially where all organizations should be kind of focused. The top line on this is that we are in a world that is riskier than it's been in the past. We used to have potentially one crisis happening at a time. Now we're seeing across most geographies, including here, you're starting to deal with multiple crises at the same time. Those were a few years ago defined very much by climate risks, but you see a host of other issues now, geopolitical and other things that are happening as well. But what I hope was maybe an inflection point for the business community, and I was thrilled to be on the first panel because it's hard to have your talking points stolen. But unfortunately, Gene did that, so I'm going to repeat a bit of what you said, but so just bear with me. But essentially, one of the interesting things that I hope was an inflection point as far as the business community really stepping in, not as a charity, as Gene said, but something that's a business imperative, was the pandemic. So we did a lot of research during the pandemic around organizational resilience, what it would take for businesses to be resilient in the face of crises and shocks such as COVID-19. What was really interesting is we started this thinking that this would be very focused on operations, things like that, but the main conclusions that came out of that was about people, as Gene said. So essentially, organizations are just a group of people, and the people are the ones that ultimately help it succeed or fail. And one of the interesting things in the research and the surveys we did during the pandemic, asking about what that essentially looked like, was that yes, communities were increasingly online, we do a lot more in Zoom, etc. But fundamentally, every institution, and in my case financial services, but others, as Gene said, is anchored in a community, or in most cases, communities around the world. And we face common challenges, we face different challenges across different places. So when we asked business leaders what was kind of top of mind, it was really this notion of not only their own employees, how you take care of their own employees, but how you build that resilience in the broader communities in which they operate. It's very easy during a pandemic to understand when everything's shut down and you can't get people to your office and so on. But what we're talking about is a problem or is an issue that's much broader than just one shutdown. As Jean mentioned, there's structural issues in most societies that we need to look at. And so what's been very enlightening and heartening to see is that you see a lot of these organizations, many financial institutions, not just here in the US, but around the world, who have really invested billions of dollars now in various ways around community development. There's obviously still a lot to go, but I think what's most important is we saw the pandemic that there was a mindset change. And for now, at least, we haven't seen kind of any distinct kind of pulling back despite the political environment. So hopefully that's a trend that continues, and hopefully this was an inflection point that leads to better outcomes down the road.
Thank you, Andre. So another takeaway from what you're saying, there's multiple contributing factors, and there's points in time, even if unfortunate and with great loss to the world in terms of a pandemic, that there's a resilience that came from that in terms of how to do better, how to rebuild, how to rethink, and then you talked about mindset. And that being across generations, up to what you were talking about too, and how that is pulled through, and not just at that point of time when we were in great distress, but how we pull through stronger. And so that in itself being resilient. And so that strategy carries through, and where you were a great lead in when you were talking about trust, because people need to trust that strength will be there in our systems, in our communities, in our health, right, in our employment. But without trust, what do we have? And so, Courtney, your work, long-standing and for decades as well, especially from a health component, what are those trends in trust, and what are those observations that you have that I know are nimble too because of the movement and the pace that we operate in this time? Are you able to share some big picture?
Absolutely. It's a pleasure to be here. And I think from the opening words in the video and what Jean was saying at the top as well, I mean, trust is probably, I believe, the most important conversation we have to be having in healthcare and quite frankly across the board. So it really does anchor the conversation today. At Adelman, we've been studying trust for 25 years. We do an annual trust barometer that looks at levels of trust in 28 countries globally, and we specifically look at 4 institutions. We look at business, NGOs, the media, and government. And in addition to those 25 years of looking at trust broadly, we've also been doing a special deep dive report into trust in the healthcare sector specifically. We've looked at the health sector for years doing our larger report, but for the past 5 years, we've done a special report that looks at where is trust with the healthcare community globally across 16 countries that we survey. We have about 1,000 respondents per country. So our larger surveys about 33,000 people annually. This report surveys about 16,000 people. And we've seen these peaks and valleys from 2020 on to today, where we saw trust go up and trust come down and back and forth. And where we sit today in healthcare really speaks to, I think, where we see trust overall. So if I could take a first look at sort of the overall picture, what we found in our 2025 report was that trust broadly, globally, in these 4 institutions has plummeted. And to the points that we were seeing about sort of that trust in business specifically, during the pandemic, trust in business was sort of the last retaining wall of how we get things done. The public has said of these 4 institutions, and in particular with my declining trust in government to make things happen, I turn to business and employers as the place that can still be productive, that can deliver solutions, and that I as an employee see my employer as a place where things can still get done. But in the past year, what we've also seen is that the polarization politically that we've seen globally has really moved from that polarization into a state of defense. And I know that we see that in healthcare in particular. And so what we've seen is this changing mindset of, if you are not with me and aligned specifically with my personal beliefs, you are against me. And that's a very different place when it comes to trust and where we've been over the past several years, to see that in particular over this 1-year period. And so what we've seen that the impact of that on healthcare is that when we talk to people about those 4 institutions and how are they helping you with your healthcare needs, 60% of respondents globally told us, I actually believe now that those institutions are actively working against me. when it comes to my healthcare needs. They are actively blocking me from getting the care I need. And again, that is a very different mentality than just, I don't know that I trust those voices in those institutions. So I share that partially to let you sort of see the shocking data that we've seen, but also to level set that we really are in a place where we have to think about how we're engaging with the public in very specific communities in a different way than we have before. To paint one more picture of sort of a shocking data point, what we're also seeing when we talk to people individually about their health care is that about a third of respondents overall and about 45% of respondents 18 to 34 said that when they think about their own health care, they would stop seeing a healthcare provider if they didn't share the same political beliefs as them. They wouldn't trust their guidance. And we're also seeing an increase in people 7 points up this year than it was in 2022 of people saying, I'm scared, I have fears about the polarization and politicization of health and science. So all of that is sort of sitting in the microcosm of what we'll talk about shortly, which is, well, what do we do about it? And what I will say is there are positive things we can see, some bright spots. The trust in my doctor, the trust in the healthcare provider as such an important person, the trust in my local communities, the trust in my employer as a place where I can still get information that I trust and I believe things can get done. So I know we'll talk about those pieces as we move forward, but I do think understanding sort of where we are with that trust in that state of our institutions and where that trust has moved. It's not gone, it's just shifted to other places.
Thank you, Courtney. Two reflections from that. One, there is merit or value in that consistency of and transparency possibly of if when you don't have all the answers, right, whether employer or physician, to have that open communication. I know that comes through our work with risk and resilience, but I wrote that down in terms of that predictability or consistency, so they are building that trust. But then what, on the flip side of what you shared, it sounds like the feedback that you've gotten, people feel threatened quite a bit and unsafe. And when there's this rising feeling of not being safe, right? That creates more uncertainty and more divisiveness in terms of where they're landing in terms of who they trust, especially for healthcare. So I am looking forward for us getting into when we get to the people part. But for Dr. Hassan, as a practicing physician, former New York City Health Commissioner, the largest public health department, I think, globally, right? A professor, a leader across academic and research spaces. I want you to tap into all of that as you're hearing and know from your colleagues the global risks from a financial perspective. So the economic, the trust, the health. Hearing individual leaders of industry wanting to be more out front. In your evaluation, how does this impact that community level and the people that you've always stood by to protect and your leadership focused on the people within that broader community? So how does this impact that?
It's great to be here, and thanks for that question specifically. I was really glad to hear Jean's opening around healthier, longer lives being a kind of a unifying North Star for what's this all about? What is the whole point of our endeavor? It is to ensure that everyone has as much time possible to do the things that they want to do with that time to live out their definition of what a happy, healthy, and fulfilling life is in whatever form that takes. And I believe that the work of health is to create the conditions to allow that to happen. And when you think about the life of a city or any place, and how you might actualize that vision, you have to bring in all pillars of what I would call the civic infrastructure. Certainly it's the public sector, and I think public sector has a huge leadership role in this regard, because there isn't another sector that is singularly focused on the public good. And so in terms of laying out the roadmap, in terms of setting the goals, in terms of building a vision, the public sector is uniquely capable of doing that. But that doesn't mean it can deliver on that alone. And of course, then you have nonprofits and communities, a massive sector, particularly here in New York City. About 20% of people are employed in that sector. in New York City. And, it's a sector that does, in many ways, can operate as an effector arm of the public sector. We run so much of our public resources, your tax dollars, through the nonprofit sector, but we leave so many swaths behind. We fail to engage deliberately and effectively, consistently over time with some of the communities that are hardest hit and need it the most. And that gets back to this notion of trust. Trust is built brick by brick, minute by minute. Or there's an old saying that, trust goes up by the stairs and down by the elevator, right? I mean, you can lose trust very easily, but it's very hard to build. Of course, then you have the philanthropic sector, which concede a lot of great ideas in both the public and the nonprofit space. But the private sector is one that has, in many ways, been at arm's length for too long in health. I think it's a little bit of a failure of imagination on the part of our public leaders, but it's also an evolution that's happening within the private sector to realize that our fates are intertwined, right? Our fates are ultimately intertwined in that big project of improving health and extending time and the quality of that time. And so what we saw during the pandemic was that those lines blurred, and we were all a part of this common project. Fight this pandemic, fight this disease. And you saw extraordinary efforts from all four of those pillars of civic infrastructure to get behind this single common goal. In this city, across this nation, across the world, you saw people pulling together. So we asked ourselves the question, as the pandemic started to wane, end of 2021 into 2022, what if we could do that long term? What if we could establish a common health project that was bigger than an emergency, that wasn't just forged in the fire of a pandemic, once in a century pandemic, but that was actually the way we do business, the way we do things on a regular basis. So we created something called Healthy NYC, which is the city's plan to extend lifespans and health spans and reach our highest ever life expectancy by 2030, after obviously like a historic drop during the COVID era. And it isn't so much the numbers that are important, although the numbers provide a unifying theory of the case. It is the fact that across all of the leading causes of preventable illness and death, there are opportunities for each pillar of that civic infrastructure to deliver. Whether it's large employers running vaccination campaigns or health screenings. We learned during the process of building out our private sector coalition for Healthy NYC, our Champions Initiative, we learned that a group like Pfizer was putting out about 50,000 Narcan kits every year throughout the city. But we're doing so in no coordination with the city. And we're not sure where those kits are going, and now we do, right? And a lot of that was all based on what Healthy NYC was an invitation to come to the table, to plan with us, to think about us, and yes, also to speak truth about where these incentives can be sometimes misaligned. I think you're all aware that we're in this divisive time, we've touched upon it, and at the heart of it is an affordability crisis, right? Median rent in this city is over $3,500. In a place like the Bronx, the rent to income ratio is over 80, which is one of the highest in the 80 to 1, which is over highest in the country, and childcare is over $25,000 a year. So there are things that we need to be doing together, public, private, all four of those pillars, to address that underlying wealth issue, that underlying wage issue, that underlying affordability issues as a determinant, as a driver of health. But it only happens if you have some kind of partnership and architecture and a way of working together that lasts over time, and it can shift with changing health priorities and changing health needs. And so we tried to lay that out here in New York City. We passed it into law. And as I reflect on something like Make America Healthy Again, I think a lot about what would it look like if we did that seriously? What would it look like if we did that and actually believed in science? What if we did that and actually addressed root causes, like wealth inequity and wage inequity that are driving health outcomes and health inequities. What if we actually did that properly and seriously and with dedication and with collaboration? Regardless of what happens over the next several years, that's going to be the challenge in front of us, and serious people are going to have to step into that breach and take up that mantle. I don't believe that it's going to change over the next couple of years. So I think a lot about the opportunity here for the private sector to be our partners in that effort.
Thank you. So in the lines of collaboration and building that action and the leadership that cares, there has to be listening, right? The listening to the different perspectives, why there's polarization of trust. So there's, how are we doing that actively as employers, as nonprofits, and then with the intention to collaborate effectively. And so with that, all of you actually have spoken about empathy showing up in the workplace, but also in the communities where we operate. And so within the context of people and collaboration and building trust, I'll start with you, Andre, and then then we'll move into the empathy, because I'm watching the time, and I know we want to get to a lot, but there's longevity work that you've done, right? And so that was successful because of building the trust. And so the ability to listen to different stakeholders. If you could share some insight from there, and then we'll keep on moving through our panel. But I want to go back to that because you opened with trust as well.
Yeah, no, absolutely. And actually, this is an initiative I had the pleasure of working with Jean on back in the day. At the Forum, we focused on a project years ago called Living, Learning, Earning Longer. And essentially, it was how do we adapt our societies, our economies, and our employers to essentially realize the fact that 5 generations are working side by side for the first time in human history, a trend that has continued over time. And obviously it has implications from an organizational standpoint, but there's broader, obviously, as we've heard from all the other panelists as well, broader considerations around that. And I think one of the things that people tend to associate with longevity is lifespan. So we're living till 85, or in some cases almost 90 median age in some countries. But what was mentioned earlier, health span, is arguably more important. So we're living longer, but are we able to be active, or are able to live a good life? Because it doesn't really make sense to live much longer if we're not able to actually benefit from those years. And there's a lot of steps that employers can take, in particular the private sector can take, kind of to help with that. And we've seen kind of a touch and go as far as employers really investing in this. When we asked employers, what are you doing organizationally to look at 5 generations working side by side, it was actually very disappointing to find out that you had maybe one anecdotal example here or there, but there wasn't kind of a more systemic thinking, especially at the C-suite level, on what this would look like in the future and what organizations were kind of already looking like. And we've seen some incremental change there, but I'd say we're still, generally speaking, in most organizations, a bit behind the ball there. And it's not just even on health outcomes and partnering with your employees on the healthcare side, it's also on the financial side. So financial literacy is something that I think we've struggled from an education standpoint, from a societal standpoint, to really build out widespread financial literacy. And if you're going to have a great health span, if you're going to have a longer life, part of that is being financially secure and building up over time the tools and the knowledge to the best of your ability, especially today, as was pointed out, with affordability issues being top of the agenda, people being able to make those informed decisions. And I fear that that's something, as long as I've been working, we've talked about financial literacy as something that's absolutely critical and crucial, and a skill that everyone needs to develop. And yet we've seen, if you look at the data from around the world, here in the US, but also in other countries, you've seen over the years that we've barely kind of made huge progress in having kind of more widespread literacy. And again, this is not something the private sector can do by itself, but it's something that, as was mentioned here earlier, we've seen more and more people try and align their beliefs and align their expectations with their employers, and you see people leaving employers all the time when they feel that's not the case. And part of that is, again, investing in your people. It's one of those cliches. Everyone says people are an important asset. We must invest in our people. But generally, you see that the investment is not systemic in the way that we might have expected, given some of the challenges we're seeing. So that's one of the areas I think that the private sector has some more work to do, in collaboration, of course, with the public sector, which was, as stated there, brings that crucial leadership component as well. And we've started to see a bit of it, but I don't think we fully grappled with a lot of the changes we're going to see organizationally, but also societally, from the fact that we're living much longer than we have in the past. And we have now a situation where, again, you're going to have 5, maybe down the road 6 generations kind of working side by side. And what are all the implications that means for our organizations and society?
Thank you, Andre. A nice theme linking the both of you is that financial literacy, helping with understanding what is affordable and what is not, right? And that what is livable. And then the active listening that's demonstrating from employers across sector that this is really important to people, that I could care about my health, but I need to be able to put a roof over the head, or I take care of my family. There's certain things, and to be able to navigate that landscape, it's a lot. It's not any one thing, as we talked about at the start with the rising risks, right, and the uncertainty. And the pace. We haven't talked about pace yet. The pace of living, not just working, is fast and doesn't slow down unless you figure out, again, on the individual, to slow it down. And so there's this onus on the individual that things are becoming harder, right? The cognitive load as well. And I know, Alf, that was important to you in terms of why the investment in mental health as a leader. And so going back to this empathetic listening, Andre mentioned cross-generational, and I want to get to the trust work within multi-generational, because there's some specific health insights. If you could just glean on a couple things, and I want to go to Arif about something he did recently with an investment in empathy for the people.
So I'll get to empathy, but just to give a little bit of an overview too, engagement into where the public is getting their healthcare information goes into why empathy is such an important thing for us right now. Even with some of the dire data I shared at the top, 2/3 of respondents told us, I actually feel engaged as a health consumer. I feel like I know where to go get information. I can tell good information from that. I can go ask questions to the right kinds of people. So people are feeling motivated as if they know where to go get that information. But at the same time, we know that plummeting trust in media and changing attitudes with experts mean people are getting their information from so many different sources. And a lot of that is coming from changing attitudes with our youngest adults. So when we looked at the 18 to 34-year-old cohort specifically, our youngest adults, your youngest employees, people coming up in the workforce, young parents who are now thinking about raising their children and making healthcare decisions for their families, we're really seeing a different health ecosystem that is very peer-driven and looking at more personal impact, but also an interest in community impact and local decision-making as well. But the changing attitudes here really include a younger generation that is looking for information in so many sources. This generation is more highly consuming information than other generations, and they are more highly sharing that information. But they are looking for it with different voices. And one of the things they tell us is, well, 47% of us, 18 to 34, believe we can be as informed as a doctor if we do our own research. And we know that own research largely is being done online, searching for information. So they're finding information. They're validating it by checking multiple sources that they are reaching out to. And when they find enough to make a decision, they're making a decision. But it may not be with their provider. And a growing number of them tell us that in the past year, they've actually made a healthcare decision that went in the opposite direction of what their healthcare provider recommended to something they heard from a family or friend or something they found online. But why is that? We really wanted to get to the heart of why might you turn away from even a trusted health professional you have a relationship with. And what people told us, the number one reason was a lack of empathy. The academic credential that an expert has is still the most important credential they're looking for. But then the secondary piece is, I don't feel I can relate to you, you can't relate to me. We don't have a shared lived experience. I don't feel like you understand where I'm coming from. They're closing out that decision making and turning elsewhere, which then
makes sense. Why might family and friends now be just one step behind HCPs as the most trusted expert people are getting information from? That's a shocking number to think 82% of the public say, my doctor is still my most trusted source of information. But just a little bit behind that, about 76 to 78% say family and friends are my next go-to for health information. Why am I turning to social media? Because I have a frequency and a relationship with voices that are sharing information online. Young adults tell us they are very interested in getting health information from medical professionals online, but they're just not finding enough of them. So they're turning to other people who maybe share a disease area, come from a similar background. We live in the same community. So you see where that relationship, that personal, really comes into play and starts shaping what we're seeing. And so the idea that you could be turning to someone that's not a professional becomes part of where we really need to think about how we're engaging at that community level and locally in different ways to make sure we're bringing the information to people where they are. And this isn't just young adults. We're seeing changing trends with older adults as well, but we do see it in a highest level of change with our youngest adults.
Well, it's so interesting to hear these data, and I don't know when the survey's from, because the thing that's missing from everything you just said is that AI is changing everything. And so in my current role at a fund, I've seen a lot of AI projects come across my desk, and I'm talking to a lot of folks in the sector, providers, payers, other stakeholders, patient advocacy groups, and that large language models are fundamentally reshaping the interaction. A recent survey, I think it was Kaiser, said that 70% of patients feel comfortable going to an AI agent, at least for first pass information on a health condition. And a similar percentage said that they expect their doctor to be using these tools too. Not as a substitute, but as an adjunct or validation. Because I think what AI is showing us is that none of us can process the vast volumes of information that are out there. I'm not a techno-optimist, I'm a techno-inevitablist. So the idea that we can sort of hunker down and protect and fight back, it's happening under our noses. And the question is whether we're going to shape it for good, for making care safer, for making care more trustworthy, for making care more equitable, for making care more accessible, or whether it's just going to shift around, the current status quo, whether we're just going to see a big, M&A wave in the sector as, payers become less relevant and providers become more powerful. So, look, I think that this is so interesting because I think this technology is reshaping the very notion of trust and the very role of clinicians, which is that asymmetry of knowledge and that credential has been how we've worked for our entire history. And now you can have patients who genuinely walk in with as much or more information than you have.
It's providing agency
which
and
is
access.
Wonderful on one level, and really we need to figure out how to manage that relationship, and it shifts our role as steward, as partner, as coach, as navigator, and less about as educator, less about as didactic, and unempathetic. I think it makes us lean more into things like empathy and caring because they know that they can get information elsewhere.
There's a reimagination of work, roles, what collaboration looks like because of the disruption. And to what you're saying, Dr. Hassan, everyone has a role in that. It's not just happening to us. It's how you invest that time, that investigation, and effort to redefine as we're using it. It's not, okay, let's get it perfect and then we can do it. And that's the hard thing, right? There's this simultaneous.
And it's happening underneath our noses as we speak. And it's happening, you talked about pace. That pace of change is faster than I think any of us appreciate, because we're not necessarily seeing it in our doctor's visits or community interactions yet. But wait 6 months, 3 months, 6 months, 18 months. This is going to happen very quickly, and the question is, are we going to shape it and drive it towards the things we want as a community, towards healthier, longer lives, versus just sort of shifted shifted revenue.
Arthur, I want to turn to you before our final question, where I'll ask everyone for one more action or insight for the group. And it's something from last year, I think it was last year, where you were a part of a larger session from the Milken Institute this time, and it was focused on leading with empathy. And there were maybe about 60 large employers that were there. And the idea here was focused on whole person health investments. It's good for business, people, and the surrounding community. And you were a part of that conversation. I'm just going to share some reflections from that for you to react to then share, because we're wrapping up almost where we started in terms of, as a leader, this was really important to you, seeing that this is what people needed to hear from their leaders. And so some insights that came from the larger conversation are uplifting employers as valuable public health partners. So the industry wanting to be valued because they have communities in themselves. And so reaching out to each other, not just doing for, right? Doing with and together. Trust and transparency as core components of empathetic leadership. The transparency being, even when you don't have the answers, figure out how to way to communicate, not just to be silent, because that in itself is communicating something. Listening builds the trust and resilience. And then the last piece was uplifting employers as, the last one was listening builds trust and resilience. And so you've demonstrated that within your organization with different things you want to do, but even more so here, what you're trying to lead and be a part of. So if you have any reflections on that that you want to share, and then we'll go through the group as any final comments.
It was interesting, I think, it's a 2020 life-changing moment for all of us, but for companies, it was not only just a resilience, but how do you actually operate, and frankly prepared us for this evolution. I think Ashwin mentioned, companies are going through evolution. How do you engage with employees? Just a small anecdote where one of the biggest things that we lost when we went virtual as employees, as corporations, was you couldn't tell what that individual was feeling like or doing, or even physically, whether they were in health or not, or in good shape, because they're all on Zoom screens. And so one of the things we started as a company was to have weekly engagements with individuals. So leaders had to reach out and engage with the individual. And a colleague of mine coined this term, which at that time we all laughed at, but certainly made a lot of sense. So HDR, heavy, direct, real conversations. Like what we're talking about. But it was just reaching out, not talking about work, but just talking about what's your physical. Are you in a place that you have access to things, or if you're taking care of your kids or parents or yourself, what's happening with you, right? So I think it created a different level of listening and empathy. I'm not saying consistently this was applied, everybody did a great job, but I think it created the opening for leaders to engage in a different way. Fast forward now, one of the things that we are challenged with as both a company, but I think as an industry, is we've asked people to come back to the office. And come back anywhere from 2 days, 3 days, 4 days, some people are even doing 5 days a week. And what we are starting to see a lot more, and I deal with this daily, is because of the 5 generations, people are not only dealing with their own issues, they're also dealing potentially with aging parents who are in the house, or they're taking care of them, young kids that they're taking care of, other people, and so on. Right? And then, as you said, the environments become much more intense with all the issues. And what I felt very strongly was we did not have an ability to engage, to talk to employees, particularly about mental wellness. In the past, it's been a stigma. It's been a topic that nobody felt comfortable engaging, particularly in the workforce. You never ask somebody, "Are you okay?" Right? And physically, you can ask if you see somebody wearing a cast or a bandage or not being well. But part of the reason, and not a lot of employees of mine told me the reason they're not reluctant to come back to work is because they still feel scared to enter public transport, mass transit, because of pandemic effects. Groups of people scare them. We have a big operating center in Minneapolis, and as you know, the events following George Floyd in 2020 created a real challenge for that city, particularly in the downtown area. It still is. There's been a large rise in crime and other issues, and it's pretty empty because a lot of the companies haven't come back. The physical footprint has shrunk a lot. So those things prompted a desire to engage in how do I equip myself, but also my other leaders, in being able to talk to employees about mental well-being and what can we do it. The company has good resources, right? So our healthcare package, benefits package includes wellness components to this, access to mental health counselors, insurance pays for it, things like that. So companies are also stepping up, but till you have that conversation, a lot of employees don't even know those resources exist. So how do you guide them?
Thank you for that. And I remember you also mentioning that your business evolving as well, where the more, especially when it's client relationship, that there's more of what you see from your employees was also coming from that. And so there is an investment from a business, there is an interest, there is an effort in terms of how we listen empathetically, how we act upon that, how we then invest, and that transcends into our broader communities.
One other thing that I just finished with saying is, it's a bit of a sell for my company, but we switched so we're an investment firm, we switched our metric for clients from investment grade or return, which we still provide, but really about financial confidence. And that's the yardstick. So it's measured, it's reported out to that client, and it's based on like for peer group, right? So it doesn't matter whether you have $10,000, you have $10 million. Are you confident in what you want to achieve? It could be short-term goals, long-term goals. So that confidence, it goes back to what you're saying, financial interest is a huge component. We want more consumers because that benefits us as a company, but the investment is not there in the country yet to really drive it in a mass way. My kids got exposed to the stock market game in middle school. And I was like, what are you talking about? I mean, yeah, capital markets is an important thing, but they didn't know what a checkbook was. They didn't know, what FICO or how do you actually establish yourself, right? What's budgeting? And that's critical that we reinvest in that space.
Thank you. So we'll get final comments from Andre, Ashwin, and Courtney momentarily. But just to wrap things up, we had big picture. We have big picture in terms of macro, whether risks and change, whether it's economic, business, community, but the importance of collaboration. It's not off the shelf, it's not what was done 5 years ago, 15 or 20, it's redefining and reimagining that, taking into that human-centered approach, right? Because we heard about trust and empathy and longevity and not discounting, if we want healthier communities, healthier people, we have to also think of needs, whether it's financial stability, affordability. So these are all factors that have to be looked at in a comprehensive way because we're focused on people. And with that, the investments of healthier people, healthier communities, and thriving, whether economically and health-wise, we have to consider all those elements and each other's expertise from the different backgrounds, whether for-profit and industry, nonprofit, academic, government, because we all have something to offer with that. And so with that, Andre, I'd like to turn to you in for closing thoughts and to thank you, Dr. Vasan, and then Courtney, and then our thank you for that last bit as well that you just provided. Andre.
Thank you, Sabrina, and thank you, Jean, again for the invitation to be here. I think my closing comment would be one of hopefully some optimism, but also on this notion that we, I think, continue to need to do a bit better. We've talked a lot about different stakeholder groups. They've tentatively maybe moved in one direction. We've started to see partnerships here or there. I think as societies and as employers and others, we need to continue to think more systemically about how we collaborate on a broader scale, not just for health issues, but for all the other things we've talked about, financial, etc. I thought I was not going to talk about AI, but I'll just mention one thing about AI as well. We're obviously, like many organizations right now, focused very much on the implications of AI. And I think we look very much at using ChatGPT on a daily basis, things like that. I don't think we've had honest conversations in our societies and our elections, etc., about the profound impacts that AI is going to have, that are having now, but the pace, as you mentioned, is going to accelerate over the next 3 to 5 years. So if we're here in 5 years, it's going to look extremely different. We looked, for example, at 20 industries and what the implications on workforces would be with the adoption of AI at the scale that it's going now and even turbocharged down the road. And we found that over half of those industries that in 5 to 10 years you could theoretically automate over 50% of jobs in all those industries. Financial services was actually number one in most of those cases. Imagine if that actually comes to bear, what the implications that has for our communities, for our societies, etc. And I don't think we've really had conversations like that. The number one job in the United States is driving, so truck driver, taxi, etc. Anyone who's been in California, you've already been able to go in driverless cars. They're fantastic. I love using them. But imagine the implications on society if you wiped out, for example, that one profession with driverless trucks, driverless cars, which is the direction we're going in. And I think as communities, we need to be very careful on the public side and the private side to really have honest conversations about how we, first and foremost, to the point was made earlier, how these technologies can augment our workforces and our societies rather than do anything around replacing things of that nature. But just more broadly around AI, when it comes to healthcare, financial services, etc., I think we just need to be more systemic. I think it's very different to be a leader today than it was 5, 10, 15, 20 years ago, certainly a CEO. And I hope that we'll continue to see C-suites and public leaders really step in more. We have learnings, we've seen things that have worked, we've seen things that have not worked, but unless we're more deliberate and systemic on a broad scale, we're going to continue to struggle, I think, to get to the outcomes that I think everyone in this room would hope we could get to sooner. So that would be my call to action, that we use forums like this and forums in other areas, including our own, to make sure that we're having these conversations and people are really working towards action and not just paying lip service perhaps to what they deem important, but are not actually putting that effort behind it.
Well, you're all here, many of you representing large private employers, because you know you're a part of building health in the communities that you serve and the communities in which your companies thrive. And so that in and of itself puts you ahead of the game, because I think you are sort of laying yourselves out as industry leaders, whatever industry you're coming from. That recognition is important. And the way you use that is equally important. One of the reasons I'm really glad to have Arif and Ameriprise here and to hear his perspective on how to build up financial security, confidence, literacy, and the sort of architecture of financial health is that it's going to take firms like his leading into that space to build health of not just the employee base, but the community. But I also think that we see quite often, and having sat in the seats that I've sat, employers only raise their voices when they see a problem, right? So I don't like what I see on the subway. I don't like what I see on the streets. That visible, small visible fraction of what causes disquiet and ill health cannot be the only place you engage. You have to engage much more deeply in what builds health, right? The building blocks of health in our environments, in our communities, the air we drink, the air we breathe, the water we drink, the schools we go to, the access to healthcare. All of those things are a part of the foundation of building healthier communities. So it's one thing, you can't just be on the receiving end talking about the problems. It's important to engage in the solutions and to be a part. That will bring you and give you a seat at the table. And I encourage you really to push your leaders. We're at a really challenging time in political leadership, as you all know, and you have some voices in the space pushing the private sector away. You have some voices in the space pulling them in close, and maybe sometimes too close. I think a balanced relationship is really important, but one that ignores it on either end it ignores your critical role is probably a miss. Last thing I'll say is back to where I ended my last remark, is AI is perhaps the most powerful change agent that we have seen in our lifetimes, in any lifetime. It's the first labor transition that is going to affect white-collar workers at scale. Healthcare and the building blocks of health are no different. And so as you're thinking about how to support your employees, how to enhance their EAPs, how to build up more financial health and wealth for them so they can be resilient to the ups and downs of changing health, I think it's important to put more power back in their hands using tools that they're using in their everyday life anyway. So getting smart on how AI is changing the relationship, changing the sort of power valence of how someone engages with their employer and how someone engages with their own health, I think is crucial for employers to know and to build into their suite of services, build into their EAPs, and build into their offerings, so that people feel like they're in control, that they have more choice. Because if you don't give them that choice, they'll go seek it elsewhere and they'll find it, and it may not give you the answers yet, right? So I would say those are the three things to take away from my perspective.
So thank you again for being part of such a great conversation. I'd like to leave you with 3 building blocks to think about what we can collectively be doing to help restore trust, specifically in health, but really more broadly across our communities as well. The first is the power of trust is local. We know that when we look at how we can build back trust with communities and we look at what is the common denominator, regardless of people's political affiliation, regardless of people's age and other demographics, local voices and local trust is the most important piece. And that's my doctor. It's my local health authority. Yes, even with health authorities under attack for not having as much trust, people still have trust in their local health authorities. This is an important partner for all of us to be thinking about. And the local power of my employer. My employer continues to be, even with slight erosions of trust that everyone is facing, my employer is such an important voice in sharing information that your employees trust, that they want to share with their communities. The second part is bringing forward solutions. People say, I need to see action, and organizations that show that they are in it to bring solutions to the table, that very act of bringing forward solutions. And then the second piece is the collaboration that we've been talking about. Bringing forward solutions with others in and of itself shows that you're invested, and it helps to build back trust. And so thinking about how are we doing, how are we providing, even bringing people along on the journey. We're coming down this path together. We don't have the full solution, but we're working on it together. And I think when it comes to things like AI that we've been talking about as well, people do trust what's local. So how are we showing solutions and tools that are in place with trusted voices they do trust? Because what our data shows is that right now, a lot of people feel that AI is for someone else. That thing that you're seeing, it's over there, and I don't feel like I understand enough of it and how it can help me. But when people see a specific intervention, a specific tool with their doctor, then they see the trust because it's coming through that partner. So how are we thinking about those powerful community, local voices, and healthcare providers to help think about the specific areas? But all of us need to be a partner in telling those stories of success to take away that fear factor. And then lastly, again, the power of the employer to really be thinking about the places that you can be stepping in to share that health information, but doing it with others. You're such an important part of the community, and if we're thinking about the collective role we all have to play in building back trust in health and science and public health, it really does involve all of us in the room today to be working together.
Thank you. Thank you to all of you very much for this time.
That was absolutely wonderful to our panel. Courtney said something that I just want to kind of build on, and she said that the power of trust is local. And it reminds me of one of my favorite quotes from Ronnie Stevenson, where he said that, you cannot be an effective problem solver from a distance. There are nuances or details you'll miss unless you actually get close. And in this environment, there's a fear of actually getting close. So what I'm trying to do throughout, and what we're trying to do throughout this day, is actually make some connections with the hopes that during the break, during lunch, that you can actually build some relationships to actually get close. That when you leave here today, that you have met one person that's not in your sector or your industry to have a conversation, to think about how are we going to collaborate to drive meaningful change. So the power of trust is local. So I just want to acknowledge the work that Dr. Katie Boston-Leary is doing with the American Nurses Association. Nurses are one of the most trusted professions in the country on the front lines. Or the work that Khalil Gray is doing from BlackRock in terms of financial literacy. Or the work that Jamil is doing representing New York City Department of Education, how critical education is as part of our social drivers of health. And we heard a lot about AI and technology. You heard me earlier talk about Square Peg Technologies and the work that Jaquay and his firm is actually doing to really bridge the gap between what organizations and also what clients and consumers actually need in order to navigate the complexity in which we find ourselves. And now we have the amazing, amazing, amazing dialogue and fireside chat that's about to take place where we're going to get very close. And we're going to hear about the importance of community voice. We have this esteemed Kimberly Blackwell joining us today. She is the CEO of PMM Agency. She's a founder and a visionary. She's a corporate director and just had received some amazing awards over the couple of days in Washington, D.C. and also California. Kimberly, please join us on the stage. And then we have Dr. Sandra Nichols, who's the founder and CEO of the Samaritan Health Project, Inc., a visionary leader in her own right. You'll get a chance to hear from her. She's a founding member of the Leadership Council for Healthier Communities. She's a powerhouse advocate for health and human rights in this country, have bridged the gaps of corporate America and also community in a very powerful way. Dr. Nichols, please join us on stage. Please give them a round of applause.
Hello, everyone. I've been looking forward to this conversation. So, first, I'd like to acknowledge Jean and the great team at CHC. Thank you for having me today. I have the distinct honor and privilege of talking with Dr. Nichols. One of the things that we're going to do is, as we're talking about creating and leading healthier communities, we got to also talk about what it means for the leader himself or herself. And so Dr. Nichols has given us permission to speak about something very personal to her that we hope as we talk about her great work will kind of stimulate some thought in how, as we all are sitting here, we are also prioritizing ourselves and our mission and purpose. So, Dr. Nichols, here today, you come, I was thinking about the profiles of all the leaders here, and you have covered quite a great span for 35 years in public health, whether it be on the for-profit side, not-for-profit side. Let's start first with where you are now and talking a little bit about the Samaritan Health Project. And I thought if you could lay a foundation into some areas we will explore further.
First and foremost, it is an honor and a privilege to be sitting here with Kimberly Blackwell. She brings about she told me when you were a little girl now. Powerhouse, top woman in PR, top woman in marketing and advertising, you name it, she has really I have the distinct honor of being called by a greater power to be the founder and CEO of the Samaritan Health Project, Inc. We all know what the word Samaritan means. It's those who are marginalized, not only in America, throughout our world, but specifically in the Bible. Man, in that particular case, but today we see men, women, and children lying on the sides of the streets, wondering where their next meal is coming from, wondering where they would sleep, wondering if they're safe. But yet we go about our daily life. The Samaritan Health Project for me was a vision from God. My life is basically because God has blessed me, because I am a walking miracle. I've died 3 times and I've had a heart transplant within the last 6 years. And I sit before you knowing every single step of the way of my death and recuperation was nobody but God. Come on. And as a side of that, which is very interesting, I fell on my curling iron. That was the most challenging piece for me. It wasn't the heart, it was the fact that I have a scar on my left hip, 6 inches long, that went all the way through the muscle. And when I finally got over to Johns Hopkins Hospital, I was at home and died at home. My daughter was there, magnificent young woman who did everything she could, got to the local hospital, and their comment to my daughter was, if she lives for 24 hours, she will be brain dead. That length of time to bring me back. My daughter, being her mama's child and her father's child, broke at my phone while I laid in a cold room and called Johns Hopkins because I had a meeting at Johns Hopkins. I was an executive at that point, and part of my responsibility was meeting with the leadership in hospitals. She called me and said, my mom had a meeting with you this morning. She died. Can you please come and get her? And within hours, they were heli-whipping me over to Johns Hopkins. I got to Johns Hopkins, I awakened in a couple of days after being on a ventilator, screaming at the top of my voice. Screaming bloody murder. And you can't help but to ask, my gosh, was she screaming and thanking God she was alive? Was she screaming that, where am I? My daughter, once again, there with me, tried to calm me down. Mom, you're in the hospital, you're okay. Doctors came running from everywhere. My scream was about, where's my phone? I need to call my office. Nobody knows where I am, right? In the midst of death. I say that to you because doing all of that time, and even during my childhood, I think my life in the Samaritan Health Project has been born out of what I see as being not tragedies, but challenges throughout my life, which began as a child watching a fantastic young 3-year-old in my neighborhood hit by a large truck. And he died because they couldn't get across the railroad tracks to him in time.
So let's just unpack
everything.
Oh, you know. Because what I'm thinking about too, and I know we all are guilty, I'm in a 12-step program. When you woke up and looked for your phone, what was that like about in the sense, because I've heard you talk about like, you know, where we felt like we had to be everything to everyone.
Yes.
And I'm wondering, when you wanted that phone, were you kind of still in that psyche of Samaritan and wanting to be so much? And is that, as we are looking at how we as leaders need to be examples unto others, I'm just wondering where you are in that journey. Because I think we all suffer from it probably more than we should.
And especially women. Women feel like we have to be all things to all people. We're super women. We are the answer to every question. In fact, my mother taught all of her children a saying when we were children. We watched her go through the same cycle. She would say to all of us, when the task has once begun, never ever leave it until it is done. Whether the task is great or small, do your best or nothing at all. And so I walk through life saying, gosh, if mom can do this with 6 children, I must do my best. And then you get around other women who are saying to you, in spite of who you are, you have to be better than the next. You have to do all of these things. Bring home the bacon, right? Cook it in a pan. Never ever let your husband or significant other forget that that he or she is in your life. You have to be the top of your position at your job. I not only did my job, I was happy to take on other people's jobs. and did not know when to stop. My husband would say to me often, that treadmill is going to get faster, faster, and faster, and I don't know how you're going to get off. My comment was, I'm Superman. I can handle this. But what we see in all of us is that none of us are super anything. If you think about healthcare itself, if you think about wellness, one, it is the great equalizer. Why is it the great equalizer? It's the great equalizer because it doesn't respect money. It doesn't respect power. It doesn't respect race or zip code or sex or genetics. It did not respect the Apple CEO. And it certainly did not respect me. I really thought at that point I was doing all of these Samaritan things throughout my life to make a difference. But I think God had to wake me up after that, dying 3 times and having a heart transplant to say, I'm the Samaritan, not you. You are just a vessel to move things in the directions that they should be moved. And so today I've learned, somewhat learned, my family would disagree with me, that I am a vessel. And it's my responsibility after I died and came back to life. It was a calling on my life to create the Samaritan Project and begin to put all of my energy, not in corporate America, but to work with those who live in the margins of America. Those who don't have, I talked about living on the street, and to make sure that my life is committed to making a difference.
I was gonna go back, because I always love to kind of hear leaders like yourselves, your origin story. And I know coming out of the East End of Arkansas, can you share a little bit about that to even becoming a physician? And I think as we sit around, you served under 2 governors, you've been, in the C-suite of, Fortune 500 organizations. Can you kind of talk about that journey? Because I see that intersection here in the room and how it then prepared you to then take the leap of faith into the Samaritan.
From the community, which is what we're talking about today, interconnection of community to leadership roles and back to the community again, right? This is where I am. And by the way, the book should be out, according to my editor sitting at the table over there, sometime next year. So I'm not going to give you all the suggestions. Curling iron faith. Yes, I fell on my curling iron. Curling iron faith. God knows my name. Wow. That's the title. That's the title. Say it again. Curling iron faith.
Curling iron.
Fell on my curling iron. God knows my name. So when you think about the journey of my life, it was always one of watching the servant leader before me. Again, my mother, my sisters and brothers, all of us are somewhat servant leader in our home life. I saw that and I knew that's what I wanted to do and to be. And I started off in practice, getting through medical school, practicing medicine in rural America, but saying to myself, this is not it. I'm only helping a few people in rural Arkansas. And I was fortunate and honored to serve, as you stated, 2 governors in Arkansas, Jim Guy Tucker and Mike Huckabee, one Democrat and one Republican, and did that for 5 years. When Clinton and Dr. Johnson Knowles went off to the national offices as president and Surgeon General of the United States. But I saw that as nearing me to Arkansas. And I saw there were limitations in funding and government fundings and the things attached to those fundings. And I said to myself, as United Healthcare came along, invited me to join the organization, this is where I need to be because it's the private sector. The private sector has more capabilities and more flexibility where there are funds to do something in the community. And I spent almost 25 plus years with United Healthcare and ultimately retired from the United Health Group. And certainly in each and every job, I saw the progression and the opportunities to serve people. But it became very apparent that the service brought me right back to where I began, which was in the community, to help those in greatest need, to help those that if the community begin to surround them, we can make a difference. So if we look at our healthcare system, our GDP is at 18%. We're spending about $5 trillion at this point. It was back in the 1970s, I believe, when those numbers were probably considered more controllable, around $74 billion or so. But the challenge we have today is that without any health care, those numbers will increase. We're going through and hearing about today the lack of affordable, accessible, quality health care. That should be a right for everyone. It's not only being changed in our system, but it's also being shut down. And so the concerns for me in the Scenario Health Project, and I would also say CHC and its leadership council, is how do we bring that intersection together in a private partnership to just make a little stone soup. And those of those who don't know, stone soup is taking some stones and putting in some hot water, and we all get a chance to work together to make a difference, because wellness and health care does not respect individuals.
With the CHC and again, opportunities like this for Founders Summit, and you kind of talked about us looking at pathways forward together. What do you really think that that's going to take? Like, you know, you have a model that you have even within the Samaritan Health Project. Talk about that model a little bit more, because I was so intrigued by it.
The Samaritan Health Project entire goal is to truly engage the community. It's been interesting to me as I've been a student of public health and a student of healthcare all of my life, is that there have been so many things that people do. We're so good at pushing things down to the community. But if you give me a bottle of water and I refuse to drink it, it is just water. If you as my physician tell me what to do, but I can't afford the medication, you've just given me great advice. If, as a parent, I cannot get my child to stop screaming in the middle of the night, then I'm going to go to the emergency room, or I'm going to try to find someone to help me. That's going to be cost efficient. The system that should be in place, and one of the things that Samaritan Healthcare, the Samaritan Health Project focuses on, is how do we not only bring the community together, but how do we help to connect the interconnectivities of those services that exist today? What is a food bank? There are so many food banks throughout our nation, but do they reach across the aisle to say, I have a chicken, you have vegetables, let's share this as a part of the community. Let's begin to connect those services across individual cities, by zip code, by community, to begin to make a difference. You'll find that oftentimes we're in our silos. We're seeing such a great separation in our nation today. We're in our silos. I truly believe if I bring the chicken and you bring the vegetable and you bring the cornbread, we could have a meal together, one which could help us from a wellness perspective, but also give us that ownership in our community. The ownership of my health, which, as you can tell by the massive heart attack that I ignored the symptoms for, sometimes we just don't stop to take a look at our own health care. Bringing it closer to home, in a community, within your neighborhood, you begin to become aware of those opportunities to improve the health and wellness, not only for today, but the trajectory for the future generation, which is my greatest concern. What happens to those that will be here tomorrow?
So let me ask this, because I'm assuming once a physician and this doesn't leave, what is it that you would say to this room as leaders, having had your own experience, that we should be doing to pay better, more attention and or care? Like, if you said, you know what, these are the things, it got me, but it shouldn't get you. What are some of those?
You have to understand that healthcare is made of basically 3 areas. It's psychological, it's social, and it's biological. If you think about it from the heart attack perspective, right, it brings into bear all of these things, such as symptoms in women are different than symptoms in men. 1 in 5 women will die of a heart attack. If I look around this room, there are a couple of women in here who probably die because there's at least 10 of us here, so that's 2, right? We also know that about 30% of our women, nationally or internationally, have heart disease. It doesn't present the same way. Women's heart attack presents with shoulder pain. It can present with upper or lower shoulder pain, it can present with jaw pain, it can present with chest pain. Well, what's very interesting in those who are greater than 50 years of age, they present with nausea and vomiting, extreme fatigue, right? Does it sound familiar? Cold sweat. It sounds like menopause to me, right? That's exactly right. Very well. And so when you're talking about health issues, people need to know their body and themselves. Having cold sweats are probably somewhat normal, and in fact, it's cold sweat and heat in a woman who's postmenopausal. But extreme fatigue and all the other things coming on suddenly for a woman in reference to all these other diseases, all these other symptoms like nausea and vomiting, should say, something's not quite right. So my first comment to you is know your body, know yourself, get in for your preventive examinations, make sure that you're exercising, that you're really watching what you eat. I didn't say you couldn't have the fried chicken. What I said is that you need to watch what you eat and to eat in moderation. In doing those things, you're focusing on yourself. Part of women's issues is that we're the last to take care of ourselves. And part of our spouse's issue, or man's issue, is that they really don't want to go. And so we have to begin to say, what is important to me in reference to being the best individual I can be to do the things that are important to me in this life. I did not pay any attention to those things. And I think it's so essential for us to do that today. And if we bring that closer to home, we bring that to a community, if I offer an exercise class for those 64 and over in a park where you bring in those pharmaceutical people from the local CVS, you bring in the exercise occupation certificate, you get the hospital to come over there and do some exams, you turn on some music, you can push wheelchairs around your community. You can get older people to walk around your community. The engagement now becomes one to where I'm not just looking to exercise alone. I've got a whole community out there waiting for me. And I have to speak for myself personally. It is very difficult for me to get to the gym unless somebody's waiting on me to do that exercising with me. So bringing the community together is essential, and putting your own health care first is essential to wellness and to a good life. At least that's the best you can do. Because as I stated earlier, illness is not a respecter of job or individual, but there are great things you can do tomorrow.
When I was reading on the Samaritan Health Project, it talked a lot about like inadequacies in practice. You know, coming off of that first panel, which was an excellent discussion, how do you kind of look at it by way of builds in the sense of AI technology? You know, how are you incorporating that?
Absolutely. AI and technology has to be the core of anything we do today. In fact, one of the greatest partners I believe that the Samaritan Health Project and any business can have today will be AI. It will be technology. It assists us in being able to move much more faster. It assists us in being able to better get input around some of the things that's being done. And it also helps the community to get simple answers to questions. And so as we talk about now the sustainability, education, understanding healthcare, you heard the last panel talking a little bit about working toward people looking at AI themselves and taking it back to their doctor, wanting their doctor to engage with AI. So essential, because not one doctor
not one person will know everything there is to them. Pulling up AI and using that information, as well as reading research works, as well as search, all of those things are key to the decision. But the person knows themselves best, going in and doing that assessment prior to getting to the doctor's office, allow for their questions to be answered and allow for the integration to be more powerful so that they can make better decisions for themselves.
So Jean kind of gave us a call to action today to meet someone new. When I'm in rooms like these, I'm very much outcomes based by way of time, because we all know that, time is very important and we can use it in different ways. I always like to pose the question, what can this room do for you?
First and foremost, know that T-shift is outcome driven. We really don't have the time in this nation to be talking about the land. We don't have the time to keep talking about what has happened. We must take action and move forward. What can this room do for me is to become a partner in order to build the infrastructure that's needed in every single community, one community at a time. I've started my pilot in Little Rock, Arkansas, which is my home. From obviously came through the Eastern Project because I know those people and I feel comfortable in trying to get back to home and working with them. The pilot, I believe, will be an outcome-based initiative that will allow for us to really build those community engagement, that efficiency, effectiveness, and sustainable model that allow people to begin to make that stone soup that I talked about, begin to work with each other, begin to improve the healthcare from a preventive and or action model, instead of just a conversation, instead of just waiting on healthcare. We can begin to make a difference today. What I need for this room to do is to take a look at our model and look at becoming a partner, from investing, from supporting, from coming forward with some AI ideas, from really working through this council in order to make a difference and looking at this model as one of the future that can truly make a difference in every community. Because if not now, then when? If not us, then who? And how do we help improve the healthcare and the wellness of all? I believe T-SHIP has that model, and we're looking forward to working with just a few great partners in this room.
And there you have it.
Wow. As the conversation was happening earlier, I thought about Dr. Maya Angelou, who wrote the poem Phenomenal Woman. And I had the great pleasure of being taught by her and to be connected with her. And so as we heard from this amazing conversation, and now we're going to hear another fireside chat, I just continue to think about Dr. Maya Angelou and that poem in my mind in terms of Phenomenal Woman, or Phenomenal Women. So it's with great pleasure that I actually introduce the exceptional Nikki Taylor, editor-at-large of Essence Magazine. Betty, please join us on the stage. And buckle up if you're not ready, because we have the brilliant Dr. Usha Blackstock, who is physician, author, founder of Advancing Health Equity. Please, Dr. Blackstock, join us on the stage for this next.
Well, thank you, Dr. Blackstock. Welcome. It is such an honor to sit and share with you today. Here you are. You can take mine. And I want you to take that mic over there. Since I've claimed this one, I understand that there's a little problem with the pickup, and I want everyone to hear what you have to say. Well, good morning, everyone.
Good morning.
All right. I'm glad y'all still making with us. So, Dr. Blackstock, these are no ordinary times. And we really have to do everything in our power to close the gap between where we are and where we need to be when it comes to healthcare. And certainly I've been on this beat a long time, and it's just, I don't want to be shocked or disrupted in not a good way, but I know there's work to be done, kind of work where you roll your sleeves up and get out there. And so the first question I want to ask you is, what are the gaps in our healthcare system that keep you up at night?
Thank you so much for inviting me. Thank you for being in conversation with me. So I just want to say I come from this perspective as I'm a physician, I'm an emergency medicine physician. I'm also a second generation Black woman physician. My mother, my twin sister, and I are the first Black mother-daughter legacies from Harvard Medical School. But my mother grew up in very different times than I did. And had to overcome many barriers to become a physician. And what I learned when I was a little girl growing up in Brooklyn was seeing my mother and other Black physicians like her working in our community, doing what we call health equity work in the 80s and 90s at a time when no one was talking about health equity. But thinking about what wraparound services look like, what does holistic care look like for our community members. So that's what inspires me today. And what I think about today is that it was safer. It would have been safer for me to give birth 20 years ago than it is today.
Can you say that again?
It would have been safer for me to give birth 20 years ago than today. And I could have given birth 20 years ago. I'm almost 48, so I could have, that's totally possible. But I say that because we've had significant advances in innovation, technology, and research, and we are seeing some of these gaps get even wider, right? And so that is what really motivates me to do a lot of the health advocacy work, the consulting work that I do through my firm, Advancing Health Equity. So that keeps me up. A lot of the maternal health issues, the issues that our communities face in terms of a lot of the structural barriers that they have to overcome. And then finally, I think what people have said earlier on the earlier panel is trust. My platform grew during the pandemic because many people had not seen a Black physician before on air. So I was an MSNBC medical contributor, the first Black physician medical contributor. I also used my Twitter. I have issues with first. We have a whole conversation about being first, but I also used my social media platform. And we talked about social media earlier, but I used my Twitter platform, and people told me, you know what? I got vaccinated because of you. I felt comfortable sending my children back to school because you talked about sending your children back to school and what you needed to feel safe sending them back to school. So I think the other gap is the trust gap, which we talked about earlier, but that is something that is always top of mind for me.
So what I hear you saying also, that it's not just about awareness, it is about engagement. And do you think that's one component of the gap, that we are creating awareness but not engagement?
Oh, absolutely. And I know this is, most recently, we've heard about the issues I mentioned earlier with Tylenol, right? And I'm like, I looked to myself and I put this on LinkedIn, like, this is an opportunity for us, not just to tell people that, okay, there's no data that shows any, causal association. There's an association, but no, it's not causal, that Tylenol causes autism. That's not enough. No.
Right.
We can't do that.
Right.
We really have to think about how do we engage with community members about, making sure that they understand this data, because, even for health professionals, it's confusing, right? But how do we co-create this messaging and the communication, right, with these sort of really sometimes difficult to understand situations come up that people are rightly very concerned about, like, should I be taking this medication if I'm pregnant, right? But thinking about, and you said, like, we're in different times now, and I always think about this is an opportunity for us to reimagine how to do things better, because we weren't always doing things better.
Right.
We have to admit that a lot of the systems that we had in place, prior to this year, They weren't, no.
Right, no. And I love that. And Jean, wherever you are in the room, yes, I am going off script, but I'm sure. That's what we do. So you are a big proponent of engagement. You're also a big proponent of collaboration. And something I read that stuck with me, that where you speak a lot about cross-sector collaboration. And I love that, because that's the part of this that I remember was great. We had community, and the doctor and the minister and everyone knew everyone, and they not only went to the office, they came to the house and so forth. But you talked about collaboration even from corridors such as business, health, philanthropy, and community as the way forward on the road to radical change. And I'd like for you to tell us why this is so essential.
And yeah, again, this is from my perspective of being a physician, where in medical school, I was taught that the biggest impact I can have on my patients is what happens in the exam room. And no, that's not accurate. No. And so I almost had to unlearn and relearn what I was taught. That yes, it does matter, obviously how I listen to my patients, how I interact with them, shared decision making. But ultimately, what makes a difference is what's happening in their communities, right? And so I think for me, reflecting, I wrote about this in my book, Legacy, I grew up in Crown Heights, Brooklyn, not far from here, and I didn't recognize that my neighborhood looked the way it looked because it was a formerly red-light neighborhood. I didn't realize that we didn't have a supermarket because businesses didn't want to come there, right? I didn't realize that we had low rates of home ownership in my neighborhood. Because of that, we had a low property tax base for our schools. My parents didn't feel comfortable sending us to the schools. So there are all these things that I didn't notice. But I noticed, and I loved my community. We looked out for each other, right? But I didn't know why a neighborhood 5 minutes away looked different. And so, I think that cross-collaboration piece is very important, because we know what happens in the exam room. It matters, but what happens even more, and I always say, who else is in the exam room? Employers are there, right? Family members are there, our neighbors are there, right? Everyone's there. And I also think in this moment, philanthropy. We need philanthropy to push innovation. Philanthropy has to step up. We need businesses to think about, and people talked about this earlier, how are we providing, benefits, equitable benefits to our employees? How are we caring for our employees? We can make a big difference with health outcomes in terms of how we care for our employees. So, I think that in order to solve a lot of these problems, we have to work together. It has to be a cross-collaboration across sectors.
Right. And that's new for us. Uncomfortable, yes. It represents radical change because we're not used to doing that. But the elders were. Yeah,
the elders were, and I always talk about, and I wrote about this in my book, and it's a lot out there, but the Black Panthers.
Right.
They were practicing community health in the late 60s and early 70s. Okay, so they weren't just, they didn't just have the free clinics. They were providing breakfast giveaways, transportation for community members to visit their incarcerated loved ones, doing sickle cell testing, right? And so a lot of these models we don't need to recreate.
Right.
We can learn from history.
We can.
And from community.
And from community. Because it's really about linking arms at AS. And that's not complicated. I'm going off script again, be forewarned. So how can partnerships between healthcare providers and community organizations enhance the support systems available and improve access to healthcare?
Yeah, I talk about this idea, and we talked about trust before, and people also often say, medical mistrust. And they put the onus on the patients and community members, and that is not fair. And that's not accurate. I actually, I talk about institutional untrustworthiness.
Yeah.
That our institutions, not just healthcare institutions, in our country have historically and even contemporarily proven themselves untrustworthy. One thing that's interesting is when we talk about different sectors, there's research that shows that even in neighborhoods with high rates of policing, like over policing in a lot of our communities, that actually impacts people's ability or want to access healthcare. Because if they have distrust in one institution, they have distrust in another institution. Okay, and so what actually that results in is a high degree of unmet health needs in our community. People don't seek care when they want to. So it's very important, I think, for health organizations, hospitals, health systems, to really think about, centering community voices. I'm all for community governance models, having community members on the boards, having them involved in developing what health equity metrics look like, because it may be different for the community what it looks like to be healthy.
Right. So it's not a one-size-fits-all. Right. What gives you hope that change is possible?
So what gives me hope is that, I talk to a lot of young health professional students who know that we can do better, and that we don't have to accept the status quo.
Right.
So I see a lot of hope in them. I see a lot of hope in this room, and in this moment that where there is a lot of pushback against the kind of work we want to do, that people are still very much committed and we're aligned on our values.
Right. All right. Another one of my own questions. In what ways can technology companies contribute to improving resources and access?
Yeah,
and because this is 2025, and I don't know, maybe I watched too many television shows when I was growing up, but I'm not seeing what I thought would be true now.
Like what?
In technology. And I mean, I know there are limitations somehow, but I just feel in healthcare we should be further along. That's just honest. So what can technology companies do?
Yeah, and I think, we talked about, people mentioned AI, and I think that I think healthcare technology, the inevitability of it, it can do a lot of really wonderful things. I think just like any other sort of system or product we use, we have to make sure that we're thinking about using it thoughtfully and equitably. There's a study that came out in Science a few years ago that showed this algorithm that many hospitals and health systems were using to allocate care for complex patients with complex needs. They're actually allocating fewer resources to Black patients, even though they had higher complex needs, but that was because they weren't able to access the healthcare system. So they were looking at resources, but not thinking about why were these patients not using as many resources, right? So we really have to be very, very thoughtful about how we're using technology and understand that it's not the panacea, but it is something that can help us move forward and close the gap.
I like that. And I think we really have to see people as people and not as stats and numbers. If we could just leap that hurdle.
Yes.
Right?
Yeah, and even as Dr. Jean said, he said, when I think about, what we can do and how we can do things better, I think of there are fewer graduation parties that are missed, right? Fewer retirement parties. I think about, the joys of life that all our community members deserve to have.
Right. And the last question. If you could ask LCHC members to focus on one bold priority, what would it be? And I mean really give all of them a call to action. I want them to leave here knowing they have work to do.
But it's what everyone has already said, it's the trust piece. The trust piece that is really, in this moment, being compromised even more. And part of that is that if you don't have trust, you're not going to have buy-in from the community. Whatever program you start is not going to move further. It's just not going to be successful. And so we really have to think about how we engage with community members, how we share power with community members, how we elevate their voices. So many of our solutions are in the community. They know, they literally have the answers.
So you're saying listen to people.
Yes.
Yeah. But the other side of that, back to trust, is I have to trust you to share.
Yes, right.
And so, again, how do we close that gap from where we are to where we need to be? What is the secret sauce to getting people to trust you?
Yeah, the secret sauce is not waiting until there's a pandemic. to, or some emergency, to then.
Okay, who's the line?
Katie, is that you?
You should be well away by now. All right. Somebody said a light alarm. Boy, I'm scared of you.
Yeah, it's not waiting.
Okay, go ahead.
It's not waiting until there's an emergency.
Right.
To engage
she's still not awake.
Yeah, it has to
be. She's losing on us now.
You're talking about it's like building like long-term sustainable relationships with the community.
Right.
Not being like, okay, I mean, that's why so many people initially didn't want to get vaccinated, because they're like, wait a minute, now you want me to do this and what? And we really have to think about what does that relationship building look like over time, so that when there's a crisis and you need to engage, you're like, people are not hearing you.
Right.
Yeah.
And time is a key word. I think we have to spend time with people. Because people tell me, like they'll go in the doctor's office, for example, doctor's got a timer on, 15 minutes, and they're saying, how you doing, and not waiting for the answer. Telling you what you need to do. And it's like, well, do you hear me? You have a moment to hear what's going on with my life, and maybe this medication's not working. So it's not as complicated as it seems. Dr. Blasak, I could talk with you for the rest of the day, because you really do see people and you really do see challenges as opportunities. Thank you so much.
So now we have an opportunity to actually take this conversation global and also domestic. What you've heard throughout the day is the fact that health is more than just the medical care that you actually receive. It is the trust that's fostered, because trust is a social driver of health. It is the ability to be empathetic and to actually hear, to be seen. It's also about education, financial literacy, about transportation, about civic engagement. It's about exactly what are the things that we're processing and how are we leveraging tools to actually drive our overall health and well-being. It's also an opportunity for us to really think about the fact that we all have a responsibility regardless of where we sit within an organization or the sector that we actually represent. And that is at those intersections that really groundbreaking change can actually happen. Hence why collaboration is such a powerful currency. So I have the tremendous pleasure of bringing to the stage Deb Garcia.
And so the realities of what's happening on the ground in these 75 countries is, communities that were already vulnerable are shaken to completely different levels. So I would say now more than ever, it's a really important time for us to step up and support.
So earlier we heard the focus on trust, trust being a social driver, and the urgency for all of us to really act. And I'm wondering if you could share with all of us here, these leaders, particularly if 90% of the doctors are from the communities that they actually are representing. What are some of the ways Doctors Without Borders is supporting them as they do this hard work?
Yeah, and I just want to clarify this, 90% not locally hired doctors, 90% of the staff. So when we work in an environment, first of all, it's not a one-size-kind-of-fits-all. We sometimes work with ministries of health, sometimes we're the only actor and we work independently, sometimes we work with other community-based organizations, and our intervention, if you will, could be in response to a conflict, which represents about 30% of our work. It could be in response to a natural disaster, but it could also be in response to environments where there's systemic barriers to certain communities for access to care. So if you think of the 75 countries we're in, many of them are heteronormative. So we have specific types of projects that we do specifically for the LGBTQ+ community. So it's really looks very different, and that's one of the things that I feel most proud of about our work, is that we meet communities where they're at with what they need, and we're empowering the whole community.
So we heard the concept of trustworthiness from Dr. Blackstock. And I know that we have some foundations that are in the room. And what you said, I want to kind of probe a little bit. And you said that, we meet communities where they are. And it's going to look different in each community. And for our foundation leaders in the room who's constantly looking at impact, and what the impact of a particular intervention might mean, and that they want to see some form of standardization. How do you balance those different expectations?
So for us, we don't aim for a kind of balanced outcome. And actually sometimes our interventions, even when we look at how we spend, we really are oftentimes looking at patients that are in dire circumstances. If you're in Gaza right now, just to get medical supplies in, could cost astronomical amounts, and you're not certain if it's actually going to get there. So we're constantly making trade-offs, but we do not necessarily, I wouldn't say we're the organization that, in some ways we are the organization that you get a great back for your buck on. And we serve about 16 million patients in a given year. Now, if you look at our budget, that's an astronomical amount vis-a-vis a patient in the US, right? But would we stop because of resources? Oftentimes not. Most of our funding is unrestricted by design because we want to be able to be as responsive and make programmatic decisions based on patient need and not necessarily based on the accountability that we have to have for foundations. And so I'm a huge fan of this whole movement in philanthropy into more unrestricted funding because it allows people who do programs, it gives that trust to people to make real-time decisions and to make real-time pivots, etc.
I love what you said, and I just want to acknowledge this because we do have some foundations in the room that are doing just that.
Moving towards unrestricted funds?
Moving more towards providing the community and the organization with greater flexibility to decide
Absolutely.
How to leverage those dollars within the context of the community to ensure that they are receiving the better health outcomes, right? So this is this move, and I want to acknowledge Rigo and the work that the R. Stone Foundation is actually doing around not just trust-based philanthropy, but also looking at ways to empower community to be in the driver's seat of their own agency. And that takes some courage and to move away from the old traditional model of how we used to do things and actually drive towards this model of more collaborative, co-partnership, co-creation with the community at the center. And I think that's what you're also sharing there is the fact that each community is different. And therefore, as organizations, businesses, philanthropy, and the whole 9 yards, don't get overwhelmed by the fact that there is heterogeneity. That's actually a good thing. And that there's an opportunity, particularly through your interventions, particularly if they're very community-centric in nature, not only will you get the outcomes you're looking for, they might actually be even better.
Absolutely.
Because the community is involved. And can you share some of the things that some of the communities that you've seen around the world have basically, I think you talked about the art and how some communities are using art as a mechanism for health and well-being.
Yeah, so we incorporate art oftentimes for psychosocial kind of support. So say when we looked at in DRC, there was an Ebola outbreak, there was basically a low adoption of vaccines and utilization. And we started basically asking patients to take, I wish I had a photo to show you all, but to put their hand in the paint and actually put it up on the wall. And obviously, our staff, my colleagues, basically also did that so that they can show, we're all kind of buying into the utilization of vaccines because just like we were in COVID, like who's going to take the shot, in terms like Ebola, where people were, largely dying as a result of this. And we have this vaccine. We wanted to increase utilization. We're also using art as a form of therapy. I don't know how many of you do coloring, adult coloring books, etc. But we have been incorporating that in our interventions in Gaza, and actually even our colleagues there, who, all of whom largely have lost their homes, but are still showing up for their community and providing the health care that they can. If you could imagine working in that kind of dire environment, and holding on to some semblance of fun and normalcy. And so we use art in that way as well.
So for the last question, Deb, you have a multi-sector group here.
Okay.
And we've talked about collaboration is the new form of currency, and that no one sector can solve a lot of the challenges in isolation. What would your call to action be for this particular group as we not just launch the Leadership Council, but really think about how we accelerate the pace of change?
Yeah, so I think I would say now more than ever, which is actually going to be our end of year campaign for fundraising, is like now more than ever that we need to lean in, because so much change is happening. And, Uche alluded to this, the systems that we had before were maybe suboptimal anyway, right? And so there's an opportunity to lean in and co-create something that could potentially be even more impactful. But this is definitely the moment to be paying attention as, things, causes become more proximate and challenges become more proximate, to still be thinking globally, because, there are people all over the world in communities who really are in much more dire situations.
Well, Deb, thank you so much for your leadership. Thank you, Carlos. Thank you to our amazing partners, Doctors Without Borders. There will be here throughout the lunchtime period for us to have a deeper conversation. I want to kind of pick up on something that you just said, and I think that is a very powerful call to action for all of us. And that is that the pace of change is rapidly happening around us. Whether we like it or not, whether we want to accept it or not, the speed, the complexity, the unpredictability is happening all around us. What we can do as leaders is actually take the time to be bold and courageous, to accept the change for whatever it is, and then really help to reshape it. We heard the terms reimagine, reshape, that the current models weren't necessarily working. And if there's anything that we're learning from the last several months, it's the fact that the playbook has been thrown out the window, and therefore we need to kind of co-create a new playbook that's going to really center community health at its center. We know that throughout this morning we've had a lot of conversations about the range of dimensions of health and the important role that communities and business and nonprofits and philanthropy can actually play to really close these gaps. So the question is really for all of us here to decide, as well as those who are joining us virtually, that, do you want to witness this moment, or do you want to actually join and help reshape? And that is really the call to action for all of us, that we have an opportunity not to be on the sidelines, but to double down, that we have an opportunity to lead, to invest in the future where profit and purpose advance together, where collaboration actually fuels our overall competitive advantage, where healthier communities are the foundation of stronger futures. If just a few subway stops can mean the difference between life or death, then we cannot accept the status quo. And that is why we've launched the Leadership Council for Healthier Communities. And for all the founding members, if you could just raise your hand in this room so that way you can actually be recognized. Please give them a round of applause. It takes leadership, it takes courage to say that this is not acceptable, that this is not our new normal, that we do have an opportunity through partnership and collaboration to really reshape and reimagine what care looks like in this country. And yes, we can and we will do it. It is bold, it is scary, but it is actually possible. So if you're not a member, whether as an individual or organization, today is your opportunity to join us on this movement, to ensure that it doesn't matter where you live, that you have an opportunity to live a longer, healthier, more productive life. That this is a comparative opportunity, and I use comparative intentionally, because that we have opportunities to learn from other communities around the country and around the world that may have had limited resources or no resources, but you know how to innovate. As Dr. Blackstock and Nikki Taylor was talking about earlier, that we have opportunities to really kind of scale for impact. So let's choose today to lead boldly. Let's be relentless in collaborating. Let's center the voices of communities. Let's make health the foundation of everything that we do. And let's create a future where every person, everywhere, has the time, the opportunity, and the support to thrive. Thank you for being with us today. We could not be more excited. I want to acknowledge our team for just the amazing work that you've done. Please give them another round of applause. For our virtual audience and for those in the room, as I mentioned before, you have an opportunity. Everything is a choice. You can either be on the sidelines and talk about what's happening, or you can be bold and courageous and actually roll up your sleeves and get in the game. And let's close these gaps. So thank you for joining us today. Look forward to working with all of you. And follow us on chcimpact.org. And please become a member. All right. Thanks, everybody. Ladies and gentlemen, lunch is served.